to another exciting edition of Living at Your Highest Quality of Life with the doctors at Inspire Wellness. As a refresher, I'm Dr. Dan Neides with...
I'm Jessica Hutchins.
And it's nice to have the band back together again. We had special guest Debbie Radvar for the last two sessions talking about thermography and energy medicine.
Mm-hmm.
So good to be back with you.
Right.
And today we are talking about migraine headaches, which is a really important topic because it impacts so many people, not only in the area where we live, but this is not only countrywide, but this is an international issue that people are dealing with all over the world. So we're excited to be talking about it, and let's figure out how we can help people get to root cause and really enjoy a higher quality of life without suffering from headaches.
I mean, the incidence of headaches, especially migraines, are really, really high, like you said, all over the world. And the amount of disability and lost work and people not being able to live their normal lives is really high. It's one of the, I think, the top 6 reasons for disability and time off work. So I'm sure anybody with a migraine listening can imagine, you have to take off days of your life. And if you have young children, you can't really take off parenting. So that becomes difficult. It's not like just taking off work, but you literally have to shut yourself in a room with no sound, no light, no kids, no any kind of stimulation. And it's a really common reason for people to go to the ER too, because once they start, they're much harder to stop in the middle. And a lot of people need the medicines provided by the ER to stop them. So the best bet is absolutely prevention. And we want to try to give people a much higher quality of life so they don't need to plan their whole lives around what if I get a migraine now. And some people who get migraines related to their periods, they don't plan anything for a whole week of every month. And that really kind of bums people out and leads to decreased quality of life. So, we're here to help. But let's start off with maybe first how conventional medicine looks at migraines and try to take a step back and see why that might not be the best way to go about it. So talk a little bit about that.
So yeah, conventionally, first, again, just sort of piggybacking on what you're saying, it's kind of in a way overwhelming how disabling migraines can be. And when you talk to patients and they tell you how many lost days in a week or a month that they suffer, and having never experienced problems with migraines myself, it's amazing to hear their stories, but it's pretty consistent about how disabling it can be. So recognizing the training that I had as a family doctor, kind of in the conventional world, we basically lived in one of two areas as we were dealing with migraines. So that would be either abortive treatment at the time of a headache or preventive therapy. So when we're talking specifically about the abortive type headaches, certainly medications that many of you who've suffered with migraines would know, categories like the triptans, like Imitrexes of the world, or Relpaxes, those are the trade names, which patients can use once or twice in a 24-hour period, and it comes in oral preparation. I remember in my previous practice, we used to give injections of Imitrex when things were so severe for people because they couldn't swallow a pill. They were so nauseated, with the headache. So, but the problem is the side effects, and then dealing with those side effects month after month or week after week, depending on use. Non-steroidal anti-inflammatory drugs. So that would be things like Motrin, Aleve, naproxen, ibuprofen, I think I said. But these anti-inflammatories have side effects. Celebrex is what I was thinking of, which is a prescription, or Mobic. These things have side effects, and the idea that people are using these on a regular basis, recognizing that they can be toxic to the kidneys, they can be toxic to the liver, they can be disruptive to the microbiome, they alter gastric acidity, which can have serious consequences to the lining of the stomach, as well as, again, to the microbiome.
I mean, they definitely contribute to leaky gut as well, chronic use of Motrin and NSAIDs.
And I think about people that are, using these on a regular basis to treat pain, whether it's migraines or some other pain. But ultimately, we're really just robbing Peter to pay Paul in that regard, because at some point a problem is going to develop with chronic use of these anti-inflammatory medications. Anti-nausea medications, your things like Phenergan is an example, prescription strength anti-nausea medication, not without its side effects. It can cause sedation, and most people who take anti-nausea medications, have to lie down and will lose hours because they can be so sedating. Narcotics, people can be dealing with such severe pain associated with their migraines that they're taking medications like Percocet or Vicodin. And I don't really need to go to chapter and verse about how debilitating they can be, how problematic they can be to the individual user, but we recognize that Percocet and Vicodin became gateways to the opiate epidemic that we're now dealing with in this country. And I'll remind you that there were 72,000 deaths attributed to the opiate epidemic in the United States last year. 72,000. So
don't forget about the Tylenol either.
So again, we have other comorbidities associated with medication. So the set in Percocet is acetaminophen. You're right. Tylenol can be toxic to the liver, and we certainly have to be mindful of that. And then the other major group of medications that we will use in an abortive treatment would be corticosteroids, like your prednisone. Again, can be particularly problematic in long-term use. It can lead to osteoporosis, so you're losing your bone density. It can contribute to diabetes and weight gain. So these medications are not without significant side effects. Then when we look at, so that was the abortive side. Now when we're going to look at the preventive side, we have prescription medications like beta blockers. So your atenolol or tenormin would be maybe some familiar names. Again, these have side effects. They slow your heart rate. They can make you tired. SSRIs, so antidepressants, can be used in preventive ways. So that would be your Prozac, your Celexa, your Lexapro. Again, side effects with long-term use of these medications. As of late, Botox has become sort of in vogue to help people try to prevent headaches. Again, those are injections that people go into on a fairly regular basis that they put throughout the scalp to try to reduce the severity or even the frequency of headaches. Again, you're talking about injections, and those can be themselves very painful. And then anti-seizure medications, things like Topamax, topiramate would be in that category, and other anti-epileptic or anti-seizure medications that can be used preventatively. However, the big problem with those is, again, side effects. Side effects. So let's talk a little bit about the functional medicine view on migraines and what we can do. But again, one thing that I do want to remind us, when we are looking at the drivers of chronic disease, it's important that we continue to shine a light on our three major categories, which would be inflammation, nutritional deficiencies, and inability or challenges in detoxifying out what the body does not need to hold on to. So those always have to be top of mind for us when we look at the functional medicine approach to not only treating migraines, but again, getting to root cause. So if you want to spend a little bit of time on that.
Yeah, sure. So a lot of vitamin and mineral levels can be off that can change the threshold for headaches. There are a lot of things that can cause inflammation that change the threshold for headaches. So there are two different ways to look at what the environmental impact might be on headaches. One is the trigger, like the specific trigger. So, 5 minutes after you encounter this, you get a migraine. And then the second thing is the threshold for that trigger to be a problem. And all of these things from a functional medicine standpoint really help to raise that threshold. So inflammation, even though there's lots of technical causes, and mostly in most cases more than one cause at one time for a migraine in each individual person, if you really identify all the sources of inflammation in that person, then that can really raise that threshold for whatever triggers. And then also for functional medicine, we can try to identify different triggers. One of the probably the most useful things we use in functional medicine for migraines and headaches specifically is to look at food sensitivities, whether it's through IgG testing or doing an elimination diet to really see if your migraine frequency went down during the month of the elimination diet, and then all of a sudden once you reintroduce one food, then migraines happen again. So there could be very specific immune reactions that can cause inflammation to be triggers. And then there are different food categories, tyramines, in cheese, hard cheeses and wines and things like that most migraineurs kind of stay away from automatically. The gut is a big source of inflammation too for any kind of chronic disease, but including for migraines too, even though you wouldn't think maybe the gut and the migraines are related. Specifically something called LPS, which is lipopolysaccharide, which is a byproduct of what we call gut dysbiosis, or an imbalance of the gut bacteria. When you have a leaky gut, this LPS can leak through and it creates this rampant inflammation, which can lead to migraines in some susceptible people.
What about just looking at the bacteria? So dysbiosis. So that's the term when the microbiome, or the wonderful set of organisms, collection of organisms in our gut, is not optimal. We know that people that don't have an ideal microbiome can have a higher threshold for developing headaches. And to me, this is the cool science that's being looked at right now. For people who don't think that there's a connection between the gut and the head or the brain, you're dealing with a head issue when you're dealing with migraine headaches. But I find it fascinating. There are 500 times more messenger molecules going from the gut to the brain than the brain to the gut. So we know that there is a deep, deep connection. And if I had a crystal ball and looked 10 to 15 years into the future, what medicine would look like, I have a feeling that we're going to be looking at very specific organisms to treat or prevent diseases like migraines. And so as we map out the microbiome and become much more familiar with these organisms and what should be there and why, and what are their roles as it relates to organ-specific function and disease, I think this is really cool science. So again, this is another area where we look at gut health that help drive the root cause for you, the patient who's dealing with migraines. I didn't mean to.
And as far as vitamins and minerals, it's obviously very individual, but if you had to just pick one vitamin or mineral that would potentially have the most impact, it's magnesium, hands down. I mean, magnesium changes the resting membrane potential of the cell, which is, one of the ultimate things that happens in the migraines, is that resting membrane potential is off and it causes these cells to fire a lot. So magnesium, anywhere from probably 400 to even 1,200 milligrams at bedtime. It can help sleep, it can help anxiety. I mean, we're pretty much all low in magnesium. There's some B vitamins that are helpful too, B2 especially, but honestly, magnesium. Right. Magnesium. Also GABA, which is a calming neurotransmitter that can help decrease, especially in people who know that MSG might be a trigger. So MSG has glutamate, it's monosodium glutamate. And that glutamate is an excitatory chemical in the brain. So the GABA can kind of quench that excitement and and by taking in GABA, that can actually raise the threshold for the triggers of the migraines to follow through.
So, right. So we're up against it time-wise already. I'm just going to run through some of the other things that we look at. So heavy metals can contribute to issues related to migraines, as well as other toxins. I mean, so I know that this sounds, really familiar, and but basically these are the same concepts that we see over and over again when we're looking at drivers of chronic disease. Spinal issues can certainly contribute to migraines. TMJ, or craniosacral problems.
All right,
and
structural.
And so that actually kind of fits in nicely with our guest the last couple of weeks, Debbie Radbar. She does craniosacral therapy. So again, this could be something that helps you, the patient, or if you have a loved one that is dealing with migraines. Her techniques can certainly be a tool in the toolbox to help treat migraines. Dental-related problems. So this is a really important concept. When we're dealing with patients who have chronic migraines, we want to make sure that dental health is optimal. And so we'll oftentimes be working in conjunction with that person's dentist. Stress, number one toxin to the body. Don't want to forget that stress can certainly play a role as it relates to migraines. Genetics. We've done Facebook Live on MTHFR. That's just one gene that can be a contributor to chronic problems. But we know that people who have MTHFR mutations have issues with detoxification. So that can also be playing a role, and that may be something that you would want to get checked out, again, if you're dealing with migraines. And so, wanting to be mindful of your time, As far as treatment is concerned, it's going to be individualized. There's not a one size fits all. What we want to do is, again, getting to root cause is figure out for you or your loved one, what's going on inside the body, looking through those pillars of inflammation, deficiencies, and an inability to detoxify. And then we can put together a treatment plan that's optimal for you. So again, I think it's really important if this is something that you're dealing with month after month or week after week, and you're looking for a way out of not just relying on pharmaceuticals, but actually getting your quality of life back without having to rely on medications, then for sure, please reach out to us and let us know how we can help. So really appreciate you taking the time today, whether you're watching it live or you're watching a recap of this video. We appreciate your sending in requests for our topics. This was sent in by one of our viewers. And so we will continue to do Facebook Live on the topics that you are asking for. And again, when we're back next week, we will choose a topic that you have specifically requested, you, the audience. So just want to say thank you for participating. Hope you have a great rest of the week. Remember, it's your time to thrive. Let us inspire you. Have a great week, and thank you so much for participating. See you next week.